Puberty marks the start of sexual development in an individual. Physical changes starts and as an individual continues to adolescence. These changes are highlighted as sex hormones, undergoing physical changes and producing feelings that are sexual in nature. Since sex is usually a taboo subject, most adolescents are confused with these feelings, how to handle them, who to ask these sexual feelings, and what is considered normal and inappropriate sexual responses. The best way to understand this is to learn about human sexuality, to get to know one's own body and responses, establish his or her sexual self. What is sexual self? It is the part of yourself where you learn and understand your sexual development and how people's sexual activity, beliefs, misconceptions, and unlimited access from the internet on how sex can influence your own sexual behavior and responses. Always put in mind that your sexual self speaks your sexual health, sexual orientation, gender identity, and expression and values around sexuality. Before we begin in our lesson, the sexual self contains 9 topics that includes the sexual development, the erogenous zone, and the human sexual response. These topics will be discussed by Rose Manalo. The basic biology of sexual behaviors, understanding chemistry of love, lust, and attachment, and psychological aspects will be discussed by Mr. Clint Justin Erasmo. Diversity of sexual behaviors by Rose Manalo. STIs or STD and methods of contraceptions will be discussed by Mr. Vincent Gerald Balhimino. Now, let's begin tackling our first topic, which is the sexual development. Sexual development is a lifelong process that starts at the moment of conception. Ishara's 2006. It can be predicted as part of human development. But not everyone is expected to have the same pattern of changes or the same paling. According to kidshealth.org 2008, people are all a little different from each other, so it makes sense that they don't all develop the same way. The development of secondary sex characteristic in the human reproductive system. The table below shows the development of primary to secondary sex characteristic of a human being. The penis, testes, scrotum, seminal vesicles, and prostate glands, ovaries, fallopian tube, uterus, and vagina are primary sex characteristic of both male and female. As they develop the secondary sex, changes in their whole being can be shown in their physical appearance or in the way they move. In male, voice become much lower, hair growth on chest, face, underarms, legs, and pubic area, increase in muscle size, skin become oily and pores enlarge. Female, breast enlarge, hair growth in underarms and pubic area, hips widen, skin became oily and pores enlarge.
Human reproductive system. One of the seemingly magical things about human reproduction is that only one sperm can ever penetrate an egg. Sex, however, is not only a reproduction act in humans. The human reproductive system may be its primary biological mandate. It serves other purposes as well. It helps strengthen relationship, encourage a man to stick around to care for his child. It affects not only health but also well-being by Charas 2006. The female reproductive system. Puberty in girls usually starts between 8 to 13 years old along with the bodily changes, breast, hair, skin, hips, and voice. It is also where menarche, from the Greek word moon and beginning, the first menstrual period. The male reproductive system. Puberty starts around 10 to 15 years old and explains why some girls look more mature than boys. Some boys are being bullied by girls because they are shorter than them at the age of 10 years old to 12 years old. The testosterone hormones cause most of the changes in a boy's body. Men need sperm to reproduce, as said by the Kids Health Organization in 2008. Besides the physical changes, his brain also changes, unlike women, varying monthly to create menstrual cycles. The hormones in men's brains are constantly acted, said by Tiaras in 2006. This may be the reason why men are said to think sex more than women. In females, the ovaries produce 400,000 eggs or so every 28 days. The ovum is 100,000 times larger than the sperm cell. The egg cell carries the X chromosomes. In males, the testes produce 200 million sperm cells or spermatozoa every week. It carries X or Y chromosomes, which is the sex-determining cell, said by Villafuerte Ezel, 2013. Chromosomes, thread-like structures in the nucleus. Genes, compose the chromosome and the basic unit of heredity. Autosomes, the first 22 pairs from the 23 pairs of chromosomes. Sex chromosomes, the 23rd pair of chromosomes, and distinguishes male XY to female XX. That's all for the first topic of the sexual self, which is sexual development. Let's go on for the next topic of the sexual self, which is discussing the erogenous zone. Sigmund Freud's psychosexual stages of development and the concept of erogenous zone.
Freud believed that every child goes through a sequence of developmental stage and that the child experience during these stages determine adult's personality characteristics. Freud believed that the adult's personality is formed by the fifth year of life. Each stages has an erogenous zone's association with the stimulation and pleasure.
So, Freud used the term to describe what occurs when the person does not progress, normally from stage to stage, but remains overly involved in a particular stage. That person will prefer to gratify his or her needs in simpler or more childlike ways than in an adult mode that would result in normal development.
This chart shows the five psychosexual stages of development: the oral stage, the anal, the phallic stage, the genital, and latency stage. Each stages has their own results in developing. The role of conflicts. Conflict must be resolved before the individual can successfully advance to the next stage. Frustration, overindulgence, and fixation. Some people do not seem to be able to leave one stage and proceed on the next. One reason for this may be that the needs of the developing individual at any particular stage may not have been adequately met, in which case there is a prostration. Or possibly, the person's need may have been so well satisfied that he or she is reluctant to leave the psychological benefits of a particular stage in which there is overindulgence. Both frustrations and overindulgence, or any combination of the two, may, may lead to what psychoanalysts call fixation at a particular psychosexual stage.
Now let's go on for the third topic of the sexual self, which is understanding the human sexual response.
The human sexual response. What turns people on the faces of sexual response? In this topic, we are going to talk about the Master and Johnson's the human sexual response cycle in its four phases. First of all, we must know who William Masters and Virginia Johnson are. William Masters was an American gynecologist best known as the senior member of the Masters and Johnson Sexuality Research Team, along with his partner Virginia E. Johnson. He pioneered research into the nature of the human sexual response in the diagnosis and treatment of sexual dysfunction and disorders from 1957 until the 1990s. Virginia Johnson was born on February 11, 1925 and died on July 24, 2013. Was an American sexologist best known as a member of the Masters and Johnson Sexuality Research Team. Johnson met William H. Masters in 1957 when he hired her as a research assistant at the Department of Obstetrics and Gynecology at Washington University in St. Louis. Masters trained her in medical terminology, therapy, and research during the years she worked as his assistant. William Masters and Virginia Johnson provided the first model and psychology of human sexual response, which is the sexual response cycle. Their research accumulated in 1966 with a publication with the human response, which reported data on 382 women and 312 men observed in the laboratory in more than 10,000 sexual cycles. The sexual response cycle typically progresses with 4 phases: excitement, desire or arousal, plateau, orgasm, and resolution. Excitement is the first phase of the human sexual response cycle that the genitals engorge with blood, the vagina expands, secretes the lubricant, and the penis enlarged. During the first stage of arousal, the whole pelvic area may feel full, as erectile tissue in the pelvis, vulva, and clitoris swells with blood. The nerves in that area become more sensitive to stimulation and pressure. In the vagina, this increased blood circulation produces the fluid transudate that makes the vaginal walls and inner lips wet, often an early sign of sexual excitement. Women produce different amounts of lubricant. For some, there may not be much lubricant, or it may come later. After sufficient sexual stimulation, sexual tensions affects the whole body as muscles begin to contract. Women may breathe more quickly or experience little shivers. Nipples may become erect and hard, and a flash of rash may appear on the skin. Plateau is the second phase where your excitement peaks, such as pulse rate, breathing rate, blood pressure, increase for both men and women. A brief period occurs before orgasm. If stimulation continues, one moves into the plateau stage. The responses may continue to intensify as the vagina becomes more sensitive and the glands of the clitoris retracts under the hood. Orgasm. Orgasm is the third phase of the sexual cycle where the males will have the rhythmic feel of the ejaculatory stage that cannot be stopped, while females will have a feeling of muscular contraction at the walls of their vagina. With enough stimulation of or around the clitoris and, for some women, pressure on the cervix or other sensitive areas such as the G-spot, a woman may build up to a peak or orgasm. This is the point at which all the tension suddenly releases in a series of involuntary and pleasurable muscular contractions. Contractions may be felt in the vagina, uterus, and rectum. Some women experience orgasm as a total body contraction and release. Resolution. Resolution is the last phase of the sexual response cycle where arousal of both male and female decreases after orgasm. Unless the stimulation continues, The resolution stage occurs. During the half hour or more after orgasm, the muscles relax and the clitoris, vagina, and uterus return to their usual position, except in the rare disorder known as persistent general disorder. Masters and Johnson's work was valuable for women in exploring and asserting the role of the clitoris in sexual response. But by focusing their study on people who were very experienced with orgasm during masturbation and intercourse, they reinforced a belief that orgasm and intercourse are necessary to women's sexual response and pleasure. And by and by offering only one model for human sexual response, Masters and Johnsons missed the fact that women who do not orgasm with penetration, for example, also experience a pleasure.
Good day, everyone. Today, I will be discussing furthermore about the sexual self. There are 9 parts of this report, 3 of which will be on my discussion: the basic biology of sexual behavior, understanding the chemistry of lust, love, and attachment, and its psychological aspect. The biological aspects of sexuality include the reproductive system, the sexual response cycle, and the neurological and hormonal factors that affect these processes. These factors or aspects develop in the adolescent stage of a human. The change from child to adult is an especially dangerous time for adolescents in our society. From their earliest years, children watch television shows and movies that insist that sexual appeal is a personal quality that need to be developed to the fullest. No. Example, Jessica Rabbit, Superman, Wonder Woman shares the perfect example of having a perfect body. As a child, we only view these factors as part of them being superheroes or Jessica being a cartoon character. But by the time you reach the adolescent stage, we now see that this as something we need to have to look good. Kasi di ba we've all been on that point of our lives na conscious na tayo sa body natin because we want to look good for others to notice us. Simply, we just want to have the standards of the current society. And these things we do results in someone getting attracted to us. While adolescents and their parents generally agree about issues and aspects of life, they hold strikingly different views on sex. Parents, based on their perspective from greater experience, urge caution and restraint. Adolescents experiencing strong sexual desire for the first time and eager for all pleasures life can offer are frequently tempted to throw caution to the wind and indulge. To further discuss this topic, we all know that our parents have been in the process, which is where we are right now. So our parents base their actions on their experience, and they know the results of every action enacted. While some, or maybe even most of us, adolescents, because of our curiosity, we tend to just go with the flow, or to those who have had the experience tend to get lost in the feeling and get the liking because it is new to them. Alfred Kinsey. Alfred Kinsey is a biologist, and in 1947, he initiated a large-scale survey researching about sexual behavior. It turned out that, like men, some women are also interested in sex and sexually experienced. People also engage in a wide variety of sexual practices, both in and outside committed relationships. And some research on sexual desire shows that these factors are also shaped by psychological to neurological factors. When I say psychological to neurological factors, this is what is happening to our brain. When we experience desires, we will understand more about this on the next topic. Understanding the chemistry of lust, love, and attachment. There are physiological and psychological aspects in being turned on, being in love and attached to another person. The chemistry of love, lust, and attachment lies in our brains, which is the human's most important sex organ. The unexplained mechanism responsible for sexual attraction lies in the brain and not in the genital areas. Moving on to lust. Lust is usually an intense or unbridled sexual desire to another person. This is a phase which is driven by sex hormones and estrogen in both men and women. Estrogen and testosterone are the two basic types of hormones present equally in men and women. Women's body that excite the feeling of lust within the brain. So, on our fifth grade discussion about science, we learned that estrogen and testosterone are the main hormonal factors that develop our bodies as we grow older. But in the chemistry of lust, estrogen has also a part of us being a sexual being. Attraction. It is an intense feeling of deep affection. This phase is said to be one of the beautiful moments in life. This is the phase where a person actually starts to feel love. This is the amazing time when you truly love struck and can think a little less. Scientists think that their main neurotransmitters are involved, that three main neurotransmitters are involved in this stage: adrenaline, dopamine, and serotonin. Attachment is a strong feeling of love and sympathy to someone. It is a bond helping the couple to take the relationship to advanced levels. It instigates the feeling of bearing children and falling in love with them wholeheartedly. Scientists think there might be two major hormones involved in this feeling of attachment: oxytocin and vasopressin. So attachment is an extension of love, or an extension of attraction. The factors or parts of the sexual behavior mentioned above has its own chemistry. Testosterone and estrogen drive lust, while adrenaline, dopamine, and serotonin create attraction, and oxytocin and vasopressin mediate attachment. The psychological aspect. Psychological aspects are identified as cognitive, emotional, or behavioral dimensions of the individual experience. For example, a person may experience problems. Now, these problems are attention and memory, or incongruence in beliefs, anxiety or sadness, and difficulties with social isolation and irritability leading to explosive manners. What is the connection of psychological aspects in sexual behavior? The psychological aspect of this study is molded by other factors also, such as biological factors or hormone levels and age, and social factors like social norms and cultural expectations. Sex is a way of lessening our alienation, isolation, and aloneness. Aloneness by physically connecting with, penetrating or being penetrated by another person at the most primal level of existence. Sex substantiates, humanizes, and incarnates existence. It produces joy, love, comfort, affection, and sometimes ecstasy. In this part, it explained how sexual activities help in reconstructing our sanity and its possible negative effects. Sex reminds us of our irrationality and how we sway irrationality. This statement implies that Even though we are smart people, we tend to get irrational when it comes to sex. For example, we get unexpected pregnancies, uh, and get STDs. Sexuality for men. Most men tend to see sex as something they can never get enough of and seek, at some primal level, to disseminate their seed as widely as possible, while most women see sex as secondary in importance to intimacy, physical closeness, and commitment. Men tend to be able to separate sex from love, eros or romance, whereas women tend to equate the two. Certainly, there are expectations to these tendencies and, in some cases, role reversals. But for the most part, psychologically insignificance of sexuality indifference for females and males, which is one fundamental source of friction and misunderstanding between sexes. Now, why are there um, role reversals? For example, kumbaga nagre-reverse yung psychological aspects or the perspectives of men and women about sex. It is because of negative effects. The negative effects of psychological aspects in sexual behavior are obsession, rejection, abandonment, loss of self, fear of annihilation, psychosis, and the maniac madness and ecstasy are all potential psychological side effects of sex.
Our next topic will be the diversity of female sexuality along with its two subtopics that consist the sexual orientations and then gender identities. There are many rules about what men and women should do that have nothing to do with their bodies are built or function. This aspect of sexuality is important for young adolescents to understand since peer, parent, and cultural pressure to be masculine and feminine increase during the adolescent years. Both young men and women need help sorting out how perception about gender rules affects whether they feel encouraged or discouraged in their choices about relationships, leisure activities, education, and career. What is sexual diversity? Sexual diversity refers to the sex characteristics, sexual orientations, and gender identities. It is in general without the need to specify of which, what is what, and who is who. What is sexual orientation? It is an enduring pattern of romantic or sexual attraction, or a combination of these, to persons of the opposite sex or gender, the same sex or gender, or to both sexes or more than one gender. These attractions are generally subsumed under the heterosexuality, homosexuality, and bisexuality. In short, it refers to who individuals feel attracted to. Heterosexuality is romantic attraction, sexual attraction, or sexual behavior between persons of the opposite sex or gender. As a sexual orientation, heterosexuality is an enduring pattern of emotional, romantic, and/or sexual attractions to persons of the opposite sex. It also It also refers to a person's sense of identity based on those attractions, related behaviors, and membership in a community of others who share those attractions. Someone who is heterosexual is commonly referred to as straight. Homosexuality is a romantic attraction, sexual attraction, or sexual behavior between members of the same sex or gender. As a sexual orientation, homosexuality is an enduring pattern of emotional, romantic, and/or sexual attractions to people of the same sex. It also refers to a person's sense of identity based on those attractions, related behaviors, and membership in a community of others who share those attractions. Bisexuality is a romantic attraction, sexual attraction, or sexual behavior towards both male and females or more than one sex or gender. It may also be defined as romantic or sexual attraction to people of any sex or gender identity, which is also known as pansexuality. The term bisexuality is mainly used in the context of human attraction to denote romantic or sexual feelings toward both men and women. And the concept is one of the three main classifications of sexual orientation along with the heterosexuality and homosexuality, all of which exist on the heterosexual-homosexual continuum. A bisexual identity does not need necessarily equate to equal sexual attraction to both sexes. Commonly, people who have a distinct but not exclusive sexual preference for one sex over the other also identify themselves as bisexual. Transsexual. It is a gender identity that is inconsistent with their assigned sex and desire to permanently transition to the sex or gender in which they identify, usually seeking medical assistance. Note: transsexual is different from transgender. What is the difference between transsexual and transgender? The word transgender is an umbrella term that describes those who have a gender that's different from the sex assigned at birth, male, female, or intersex. Transsexual is a more specific term that fits under the transgender umbrella. This word can be contentious and shouldn't be used unless someone is specifically asked to be referred to this way. Transsexual isn't an umbrella term. It should never be used to refer to the entire transgender community. It's important to remember that the term transsexual doesn't include or reflect the experience of many who are a part of the transgender community. Therefore, it shouldn't be used to refer to someone, unless they specifically assert that preference. Further, some transgender people find the word transsexual to be offensive and stigmatizing. This is because of its history and roots in the professional fields of medicine and psychology, which use this term to incorrectly label all transgender people are mentally ill or sexual deviant. Gender identity. Gender identity is the personal sense of one's own gender. Gender identity can correlate with a person's assigned sex at birth or can differ from it. Gender expression typically reflects a person's gender identity, but this is not always the case. While a person may express behaviors, attitudes, and appearances consistent with a particular gender role, such expression may not necessarily reflect their gender identity. It refers to one's self-concept of being male, female, or non-binary. Non-binary is one term people use to describe gender that do not fall one of these categories, male and female. Gender roles. Gender role is a social role encompassing a range of behavior and attitudes that are generally considered acceptable, appropriate, or desirable for a person based on that person's biological or perceived sex. Gender roles are usually centered on conceptions or masculinity and femininity, although there are conceptions and variations. The specifics regarding this gender expectation may vary substantially among cultures, while other characteristics may be common throughout a range of cultures. Gender roles influence a wide range of human behavior, often including the clothing a person chooses, the profession a person pursues, and the personal relationships a person enters. What is the difference between gender identity and sexual orientation? Sexual orientation refers to who individuals feel attracted to, while gender identity refers to one's self-concept of being male, female, or non-binary. Developing a common vocabulary can help foster inclusive and productive discussions about sex and gender. That's all for the topic about the diversity of human sexuality.
The factual information about reproduction is necessary so youth will understand how male and female reproductive systems function and how conception and STIs occur. Adolescents have inadequate information about their own and their partner's body. Teens needs this information so they can make informed decision about sexual expression and protect their health. Youth need to understand anatomy and physiology because every adolescent needs knowledge and understanding to help him/her appreciate the ways in which his/her body functions. Sexual intercourse. What is sexual intercourse? Sexual intercourse is one of the most common behaviors among humans. It is a behavior that may produce sexual pleasure that often culminates in orgasm in females and in males. Sexual intercourse may result in pregnancy and STDs. In programs for youth, discussion of sexual intercourse is often limited to the bare mention of male female intercourse. However, youth need accurate health information about sexual intercourse, like it can be vaginal, oral, or anal. Here are some misconceptions that they think about having sex. Number 1. All teens are having sex. Number 2. Having sex makes you matured and adult. Number 3. A girl wouldn't get pregnant if she is menstruating. 4. A girl can get pregnant if it's her first time. 5. Oral sex is not sex. Premarital sex. What is premarital sex? Premarital sex is a sexual activity practiced by people who are unmarried. It can be any sexual relation a person has prior to marriage. The alternative terms for premarital sex have been suggested, including non-marital sex, which overlaps with adultery, youthful sex, adolescent sex, and young adult sex. Here are some factors that encourage you having premarital sex. Having poorly educated parents, unsupportive family relationships, lack of parental supervision, friends who are sexually active, poor academic performance, poor spiritual exercise, lack of involving in church mass or praying, and engage in risky leisure activities. People who have premarital sex are recommended by health professionals to take precautions to protect themselves against sexually transmitted infections such as HIV or AIDS. There is also the risk of an unplanned pregnancy in heterosexual relationships. Sexually transmitted disease. What are sexually transmitted disease? These are infections that are commonly spread by sexual activity, especially vaginal intercourse, anal sex, and oral sex. STIs often do not initially cause symptoms, which results in a greater risk of passing the disease on to others. Symptoms and signs of STIs may include vaginal discharge, penile discharge, ulcers on or around the genitals, and pelvic pain. STIs can be transmitted to an infant before or during childbirth, which may result in poor outcomes for the infant. Some STIs can cause infertility. When do STI occur? Having sex without a condom, vaginal, oral, or anal sex with someone who has an STI. It can be difficult to tell if someone has an STI or not. STIs can be spread even if there are no signs or symptoms. That's why having sex is very risky. During genital touching, it is possible to get some STIs such as syphilis and herpes or without having sex. Through sexual contact between women who have sex only with other women. And lastly, from a pregnant or breastfeeding woman to her baby. How to prevent sexually transmitted infection. The best way to prevent an STI is not to have vaginal, oral, or anal sex. Here are some of the preventive ways that you might have or prevent having STIs. Number 1, get vaccinated. There are vaccines to protect against HPV and hepatitis B. 2. Use protection condoms. Use protection. Condoms are the best protection in a way to prevent STIs when you have sex. Make sure to put the condoms on before the penis touches the vagina, mouth, or anus. Other methods of birth control like pills, shots, implants, or diaphragms will not protect you from STIs. Make sure to get tested. Just to be sure, you and your partner are tested for STIs because it is important to talk first to each other about having tested with results before you have sex. Be monogamous. Having sex with just one partner can lower your risk for STIs. After being tested for STIs, be faithful to each other. That means that you have sex only with each other and no one else. Limit your number of sex partners. Your risk of getting STIs goes up with the number of partners you have. Do not abuse alcohol or drugs. Drinking too much alcohol or using drugs increases risky behavior and may put you at risk of sexual assault and possible exposure to STIs. HIV or Human Immunodeficiency Virus. This is the virus that causes AIDS or acquired immunodeficiency syndrome. It is preventable and manageable but not curable. Since this is a syndrome, there are several manifestations of the breakdown in the body's immune system and how develop in people who have been infected by human immunodeficiency virus. How do people get HIV or AIDS? Bodily fluids, blood products, transfusion, semen, and vaginal fluids. Drug abuse, sharing needles and use of unsterilized blades. Sexual intercourse, unprotected vaginal, oral, or anal sex. Teenage pregnancy is the pregnancy that involves females under the age of 20. At that time, and that pregnancy ends, pregnant teenagers face many of the same obstetrics issues as other women. In teenage pregnancy, there are risks of low birth weight, premature labor, anemia, and preeclampsia are connected to the biological itself, as it was observed in teen births. Every day in developing countries, 20,000 girls under age 18 give birth. 7.3 million gives birth a year, and if all pregnancies are included, the number of pregnant teenagers is much higher. Prevention of teenage pregnancy. Comprehensive sex education and access to birth control appear to reduce unplanned teenage pregnancy. It is unclear if a single intervention is most effective. Family planning, responsible parenthood. In the Philippine education, the concept of family planning, also called responsible parenthood, is a mandatory topic in the curriculum. It is a simple way of regulating and spacing the births of children. Here are some benefits that derive from family planning are identified as follows. Number 1, for the family, to promote healthy, happy family. Number 2, for the mother, she can recover her health and strength after delivery. Number 3, for the child, a better chance of growing healthier and well cared. Methods of contraception. According to the Anglican Church in 1930, to allow all people to use birth control, including all religions and Catholics, to use contraceptives, which are medicines and devices to prevent pregnancy. Youth also need to know that traditional methods of preventing pregnancy that may be common in particular community and culture may be effective in pregnancy and may, depending on the method, even increase susceptibility to STIs. Concept linked to family planning is contraception, also known as birth control and fertility control. This method or device is used to prevent pregnancy. Family planning methods and contraception methods are prevented as follow. Natural birth control employs natural control methods that people do to help prevent an unintended pregnancy without the use of artificial ways of contraception. The natural birth control requires commitment when you use the decision, discipline, and self-control for it to be effective. These include abstinence, fertility awareness methods, the rhythm, calendar method, intercourse, all requiring discipline and responsibility, which the Catholic Church approves. Artificial birth control employs artificial control methods to help prevent unintended pregnancy. Use modern measures such as contraceptive or birth control. Pills, diaphragm, birth control patch, control shot, birth control implant, intrauterine device, tubal implant, and emergency contraception pills. Here are some of the examples of the artificial and natural birth control devices. Hormonal method of contraception. Oral contraceptives pills. Regular oral contraceptives that contains estrogen and prostagen or progestin. The patch. Small patch that will stick on skin and releases estrogen and progestogen. The ring. It is a tiny plastic ring that women insert to her vagina that also stops ovulation. Implant. It releases hormone progestogen, but it is a small, flexible rod placed under their skin by professionals. Injectable. It is an injection with long reversible contraceptions. Barrier methods. Diaphragm. It is used to cover the cervix and it is made from latex and used with spermicide. Cervical caps. Made of silicone and it's used to cover the cervix like diaphragm. Male and female condom are spermicides. Male condom is a thin latex put over the penis. Female condom is made up of polyurethane that loosely lines vagina and stops sperm from entering. Behavioral methods. Rhythm or calendar, also known as family planning or fertility awareness. It's a way of identifying the most fertile and infertile times of women. Abstinence, the avoidance of sexual intercourse. Outer course does not include the insertion of penis to vagina. Withdrawal, a method used by male by removing the penis from the vagina and then ejaculating outside the female's body. Sterilization. The fallopian tubes are tied to prevent eggs to travel to the uterus. Vasectomy. The vas deferens was blocked through the operation. Emergency contraception protects against pregnancy after unprotected sex occurred. So, that's all for the lessons about the sexual self. After watching this video, please go to the comment section below the video and type done if you are finished watching this video. That's all. Thank you for watching.